తలనొప్పి, నరాల బలహీనత, మూర్ఛ వ్యాధి, పక్షవాతం, బ్రెయిన్ స్ట్రోక్, బ్రెయిన్ ట్యూమర్స్, మెడ, వెన్నెముక సమస్యలు, పక్షవాత సమస్యలకు పరిపూర్ణ వైద్యం. మన దేశంలో ఎక్కడా లేని ఆపరేషన్ థియేటర్, అమెరికాలో జరిగే వైద్యం ఇప్పుడు గుంటూరులో. చిన్న కోత ఆపరేషన్ల ద్వారా కేవలం 2 రోజుల్లోనే డిశ్చార్జ్. డాక్టర్ రావ్స్ న్యూరో హాస్పిటల్, గుంటూరు. సంప్రదించండి 9010056444, 9010057444.
Diagnosis of pituitary tumor. How is a pituitary tumor diagnosed? Diagnosing a pituitary tumor is a multi-step process that combines medical history, physical examination, hormone testing, and imaging studies. Medical history and physical examination. A healthcare provider begins by discussing the patient's symptoms, medical history, and familial conditions. The doctor assesses neurological function, visual fields, and other relevant factors during a physical examination. Hormone testing. Pituitary tumors can cause hormonal imbalances due to excessive hormone production. Blood tests are performed to measure hormone levels in the body. Specific hormone tests may include prolactin, growth hormone, GH, insulin-like growth factor 1, IGF-1, adrenocorticotropic hormone, ACTH, thyroid-stimulating hormone, TSH, and others. These tests help identify the type of tumor and its effects on hormone regulation. Imaging studies. The most common imaging technique for visualizing the pituitary gland and detecting tumors is magnetic resonance imaging, MRI, of the brain. MRI provides detailed images that show the tumor's size, location, and characteristics. It helps doctors assess if the tumor is pressing on nearby structures, such as the optic nerve, and plan appropriate treatment strategies. Specific types of pituitary tumors. How to diagnose different types of functional tumors. Prolactinomas. Prolactinomas are tumors that overproduce prolactin, leading to symptoms like irregular menstrual cycles, infertility, and milk production in non-pregnant individuals. Diagnosis involves measuring prolactin levels through blood tests. Elevated prolactin levels often indicate the presence of a prolactinoma. An MRI may be performed to visualize the tumor and assess its size and location within the pituitary gland. Acromegaly, gigantism, GH-secreting tumors. These tumors lead to excessive growth hormone, GH, production, causing abnormal growth of bones and tissues. Diagnosis includes measuring both GH and insulin-like growth factor 1, IGF-1, levels in the blood. Elevated levels of these hormones suggest the presence of an acromegaly-causing tumor. Oral glucose tolerance tests, OGTT, can also help confirm the diagnosis. In healthy individuals, glucose ingestion suppresses GH release, but in patients with acromegaly, GH remains elevated. Cushing's disease, ACTH-secreting tumors. Cushing's disease is characterized by excessive cortisol production, resulting in weight gain, high blood pressure, and other symptoms. Diagnosis involves measuring cortisol levels through blood and urine tests. The dexamethasone suppression test helps differentiate between Cushing's disease and other elevated cortisol causes. Imaging studies, such as MRI, locate the tumor and assess its size. TSH-secreting tumors, TS-homas. These rare tumors produce excess thyroid-stimulating hormone, TSH, leading to hyperthyroidism. Diagnosis includes measuring TSH and thyroid hormone levels in the blood. Elevated TSH levels and increased thyroid hormone levels suggest a TSH-secreting tumor. Non-functioning pituitary adenoma. Non-functioning pituitary adenoma do not secrete excess hormones. They can still cause symptoms due to their size and pressure on surrounding structures. Diagnosis involves imaging studies like MRI to visualize the tumor's location, size, and potential impact on adjacent tissues. The diagnosis and subsequent treatment plan for pituitary tumors often involve a collaborative effort among endocrinologists, neurosurgeons, radiologists, and other medical professionals. The goal is to accurately identify the tumor type, assess its impact on hormone regulation and overall health, and determine the most suitable course of treatment for each patient.